I'm Sarah from the School of Dentistry.
And I'm Jenny from the English Language Centre.
So we're here to talk about a project that we've recently run. In the School of Dentistry, we've got a DDSC programme that combines clinical specialist training with a research doctorate. So, for example, our postgraduate students train to become specialists in things like orthodontics, endodontics, or paediatric dentistry. And alongside this, they undertake their research doctorates. And over the course of the years, we've had an increase in the number of international students joining us. And these students have often completed their undergraduate training abroad in places such as Jordan or Saudi Arabia. And their undergraduate clinical training that they've completed has been done in a very different healthcare environment. So anyone that's used the NHS recently, for example, knows that consent, for example, is a very much a two-way conversation now. Gone are the days that a doctor knows best. And also, for example, when things go wrong, as they sometimes do, we work in a very open and transparent environment where we explain things to our patients, apologise, and look to learn from those mistakes in a no-blame culture. And our students have sometimes struggled to adapt to this very unique healthcare environment. And feedback from their supervisors in clinic has suggested that they could benefit from trying to develop the skills in these areas.
So the problem that we were addressing was that sometimes students are out of their comfort zone professionally, they're adapting to a new healthcare system, experiencing a kind of professional culture shock, and they're facing the challenges of communicating with patients in a healthcare setting where there may be differences from their previous professional setting, adapting with that transition of being an expert in their previous context to a relative novice within the UK's NHS system. And all of these factors can add a dimension of potential stress to the student experience. And it was felt that they needed to be better prepared and equipped to deal with the challenges as they progress on their course. And these challenges are very much manifested in a key aspect of clinical practice. So to illustrate this, we focused on consent in a clinical setting and the process of gaining consent. And some of the issues here can be the disconnect between understanding the theory and being able to apply that in a clinical setting. So in order to address this, we devised an interactive session. And I'll just give a brief outline of that session. It began with coming up with a definition of consent, looking at the different types of forms that are used to gain consent, conducting some role plays, giving feedback, and then agreeing on a gold standard for the process of gaining consent. The students didn't prepare for the session, but they were given quite a lot of feedback on the role plays. And it was a very much a collaborative approach. So just focusing on the role plays in particular, these were designed to explore their personal beliefs, different cultural experiences with peers. So there were scenarios that they may have been unfamiliar with, such as very stressed patients in a rush, or the patient's guardian or parent being the person providing consent, but the patient not actually being in the room. Or it could be unmarried couples or single-sex couples. The students themselves were given a certain amount of information in the role plays, but not all of it. So it was a very authentic experience. And the actors that we used in the role plays, they were given more information. So there was the students were having to think on the spot in these role plays. And the feedback was given from the peers who were observing the role play, also from the actors themselves, who were the voice of the patient, feeding back on how it felt from their side of the interaction. There was the expert from dentistry giving feedback on the role play, and the expert from the English Language Centre giving feedback on the language. So we looked at things like whether they were using language that might alarm a patient and how that could influence their likelihood of giving consent. We looked at things like whether they had picked up on empathy triggers that the patient was giving them and the opportunities to empathise and support the patient. The feedback also focused on what they had done well. So it wasn't just looking at some of the problems in the role plays, but looking at what they'd done that we thought was very good.
In line, obviously, with best pedagogic practice, we sought some student evaluation following completion of this course. 100% of the students strongly agreed that the combined nature of the seminar, so the feedback from the actors, from their peers, from Jenny and from myself, was beneficial to the session and appreciated feedback from different elements. Most importantly, though, since the seminar, 100% of our students strongly agreed that they'd actively thought about the language that they were using when talking to patients. We've also gathered feedback from their clinical supervisors, who have been very positive in noticing an improvement in the communication and consent element of the clinical training.
So the next steps are that this academic year, we want to run the session again with the new cohort, refine the session, develop further scenarios, get more feedback from the students and the dentistry lecturers, but also to consider other aspects of practitioner-patient interaction which would benefit from this kind of interactive approach, where we spend a whole afternoon looking at communication in a clinical context. So we are thinking about a similar seminar, looking at, for example, approaches to difficult conversations and well-being.
And thank you very much.
Thank you, Sarah. Thank you, Jenny. That was fantastic. Are there any questions? I did have one, actually. I was just curious as to how the two of you got together to kind of work on this, because I can see how it fits really well. Kind of, how did that relationship start?
I don't remember.
It was, I do. It was, we last year was the first year that we did in-session support for the first year students on the dentistry doctorate. And this actually came up in the first meeting that we had with a group of dentistry lecturers. And
Yeah.
I remember Sarah talking to me about it at the end and saying, we'd like to have a sort of bespoke session just for this. So we worked together, sort of thinking about it, planning it, looking at the scenarios and how we would give feedback. And it was a whole full afternoon with the students. I think what was nice was that they didn't have to do any preparation. They just turned up, we did the session, and then they got lots of feedback.
Fantastic. That's great.